Alright guys, this is Jerningham here. We've got another video of Michael Gove speaking. Secretary, breaking news, produced 2 billion items of people as COVID-19 deaths risen by 134. We'll play the video.
In total, 3,681,000.
Hold on a minute.
295 tests. In total, 3,681,295 tests have been carried out in the UK, including 109,979 yesterday. 265,227
Matt Hancock's this is
tested positive. That's an increase of 2,004 cases since yesterday. Sadly, of those who've tested positive for coronavirus across all settings, 37,048 people have now died. Yesterday, across the UK, 134 deaths were reported. But for the first time since the 18th of March, I am very encouraged to confirm that yesterday there were no deaths from coronavirus recorded in Northern Ireland. I want to pay tribute to Robin Swan, my opposite number, and all those across the NHS and public health in Northern Ireland and the people of Northern Ireland who have shown such resolve to be able to bend the curve down, and thank them for the work that they've done. While the news may not be this positive every day, I look forward very much to working with them to keep the virus under control in Northern Ireland. Today's figures from the Office for National Statistics show across the UK as a whole the lowest number of deaths from coronavirus for 6 weeks. This is a national endeavour, and whatever the headwinds, as a country we can't let up on this. We're past the peak, we're flattening the curve, we protected the NHS, the number of deaths is falling. We must keep our resolve. And I also want to say a massive thank you to everybody over the bank holiday weekend who stuck to the social distancing rules. And especially to my colleagues in the NHS and in social care who are doing so much. Even though we're past the peak, there are still 8,802 people in hospital with coronavirus in the UK, and there are still 98 NHS colleagues in hospital with coronavirus, including some who are seriously ill. So we must maintain our focus. And there's 2 areas that I'd like to provide an update on today, both incredibly important for the future of tackling this disease: PPE and treatments. First, we've been working hard to build our supplies of personal protective equipment. I know how important this is, especially to colleagues on the front line. We all heard in the early weeks of the crisis the calls from the front line for more and better PPE. And we all saw the global scramble to acquire it. I have been completely open about the scale and the difficulties of this challenge, building a new supply chain from scratch, and of course the operational challenge of delivery. General Sir Nick Carter, Chief of the Defence Staff, said himself,
longer days, isn't it?
This is the single greatest logistical challenge that he'd faced in his 40 years of service. And in response to those challenges, thanks to the armed forces and to so many others, including so many in the NHS, we've seen a mammoth effort. We've ramped up domestic production. I can announce that we have now signed contracts to manufacture 2 billion items of PPE here in the UK. I set a national challenge, and I'm absolutely delighted that Lord Dighton has stepped up and is helping us to deliver against it. Around the world, we've signed deals with over 100 new suppliers, including agreeing contracts for a further 3.7 billion gloves. While we continue to improve the logistics and work hard to get everyone the PPE that they need, these new supplies mean that we're not simply keeping up with demand. We are now able to begin to replenish our stockpiles. There is a lot further to go on PPE, as on so many things, but we have made significant progress, and I'd like to thank everybody involved. And PPE, of course, is so important because it's about protecting the people who protect us. And we'll do that for as long as the virus remains on these shores. The next thing I wanted to update you on is some of the remarkable R&D into treatments that's taking place across the UK. One of Britain's greatest strengths is our life sciences, and in particular our life sciences research. And we're leading the world in the clinical trials that are being done here. As I said at this podium last week, the very nature of scientific inquiry means that not every project will bear fruit. But I'm determined that we'll explore every possible avenue. The recovery trial is the world's largest trial of potential coronavirus treatments. And because our NHS is a universal system in which we're all part of, we have some of the best data and can do some of the best research. Today I can announce that we're beginning a new trial for selected NHS patients of an antiviral drug called remdesivir. There have already been some promising early results on coronavirus patients, with early data suggesting it can shorten recovery time by around 4 days. As you can understand, we'll be prioritising the use of this treatment where it will provide the greatest benefit. This is probably the biggest step forward in the treatment of coronavirus since the crisis began. These are very early steps, but we're determined to support the science and back the projects that show promise. I'd like to thank the NHS, the MHRA, the devolved administrations, because this is UK-wide, and Gilead, the pharmaceutical company, for their work in making it happen. After all, it's worth remembering that in the battle against this virus, we are all on the same side. So we'll keep working across the world to develop the vaccines and the treatments like this that will help us turn a corner.
Wow, that was a very interesting video. Most of you guys and girls, if you watched the news, would have liked the video, what he was saying. I think he said the right things. Anyway, thank you for joining me. And like I say, what was I going to say now? If you've not seen the news from the 41,220 deaths in the UK and Wales, watch it. And it's very sad, I know. But anyway, thanks for joining me, and I'll catch you in the next video. Peace.